Good morning. My name is Erin Hambrick, and I want to give you a little bit of information about how trauma can affect infants and young children. So, as you know, this video, the content is developed by some of us here at the Children's Place, including myself. I'm a clinical child psychologist, Abby Davis, one of our child and family mental health therapists, and Maddie Tieben, our infant and toddler specialist. Here at the Children's Place, our mission is to be a place where children and families can heal from life's deepest hurts. We know that unfair things can happen even to the youngest among us, and we want to be a place of healing. And our vision, the place where we want to get children and families, is childhood restored. We celebrate healing for young children in our community who have faced sometimes the unthinkable. And we hope and know that with the right care, they can lead happy, healthy, and hopeful lives. The concept of infant mental health has really only come to be recently appreciated. I think we used to think that mental health wasn't relevant until we were much older. But in fact, infants do have mental health, just like the rest of us do. And the development of their mental health is actually quite crucial for their later well-being. When we talk about infant mental health in infants looks a little different than mental health in adults might look. And so when we describe a mentally healthy young child or even infant, what we're talking about is a child who can regulate to some degree and express emotions, form trusting relationships with close caregivers, and explore the environment and learn. We are talking about a little person who can rely on the caregivers and their environment, trust them to be a safe place, and then to be able to learn from the world around them. And this is really, really important because we never learn faster than during our first 3 years of life. Our brains come into this world ready for experience to shape them. The first 3 years of life are really the peak for developing capacities that kind of set the stage for more complex thought at later ages. In fact, 1 million neural connections are made per second during the first year of life. And so it's really important not only for very young children to have experiences, but to have experiences within the context of safe relationships that can help them feel safe enough to explore all that the world has to offer. We learn best when our bodies feel safe enough to take in what is around us. And so, like I just alluded to, these really important brain connections occur through repeated experiences, especially repeated experiences with people who we know have our best interest at heart. And so, nurturing and nourishing repetitive experiences within relationships really build the foundation for lifelong health and well being. A very stable and structured and loving early childhood is the best gift that we can give any child toward their lifelong health and well-being. And so I just like to bring some pictures into this space when we talk about very young children, because rarely do we see infants and young children pictured without a caregiver. In fact, they require really close proximity to caregivers to survive. They require feeding much more frequently than older children and adults do. They require contact to comfort them much more than older children and adults do. And that's their way of saying, hey, I can learn, but I've got to learn with you as a safe and regulating presence in my life. Unfortunately, adverse childhood experiences are things that can impact that sense of safety that we have said is so crucial for the best possible child development to emerge. And just like we didn't really used to focus as a community on infant mental health, We also used to think that when bad things happen to young children were just going to be okay. They were resilient, they were going to bounce back. Well, what we've actually learned is that the younger the child is when adversity occurs, the more likely that adversity is to potentially shape their lives in ways that are not optimal. So we've had a lot of recent research that shows that early adversity, early trauma, early chronic and unrelenting stress can become integrated into our bodies. It can change the way that we see the world. It can change our capacity to trust, our willingness to learn from our environment. And then it impacts our development, not only when we're young, but later in life if we don't have therapeutic experiences that can kind of teach us that maybe we weren't safe when we were very, very young, but now we are safe and now we can express ourselves to the fullest potential. So, what is trauma? This is a word that I think is said more and more frequently in our daily lives, but I think it's important to define trauma and really understand what we mean when we say something is potentially traumatic to an infant or a young child. Well, the Substance Abuse and Mental Health Administration, or SAMHSA, defines trauma using 3 E's. One is an event. Something has to happen in your life. The other E is experience. That event needs to be experienced as life-threatening or as overwhelming our ability to cope. And then we need to see effects. We need to see that in some way the child is struggling to cope with what happened. I think it's hard sometimes to think about trauma being able to affect young children because we think, well, when kids are little, they don't really notice sometimes the bad things that are going on around them. They're kind of shielded by their parents. And in many cases, that's true. But there are certain types of experiences that are actually quite traumatic to young children and that pretty easily can overwhelm their ability to cope. Young children really can't cope with much on their own. And so neglect, early childhood experiences where their basic needs weren't met or where their emotional and social needs weren't met. Attachment disruptions, right? One day having access to a caregiver that is consistent and predictable, and then the next day inexplicably not having access to them. Chaos and transitions can kind of upset the schedule and the routine of the child. Domestic violence can even be traumatic to children through the sights and sounds that they take in, but also through the impact that it has on the caregiver. Caregiver stress, caregivers being unable to be available and consistent and feeling afraid and emotionally tuned up themselves can impact the experience of the young child. Of course, there's also things like like physical abuse that can happen to children. Children being shaken, for example, when their crying is unrelenting. Sexual abuse also happens to very young children, and drug and alcohol exposure, either in utero or exposure to drugs and alcohol that the caregiver is using, resulting in the caregiver having less availability for the child. And the more that we've learned about trauma and young children, the more that we've actually realized that the time in our life when we are most likely to experience trauma, to experience events that overwhelm our ability to cope, is actually during the first year of life. So what does trauma look like in children? Well, when we experience something that overwhelms our ability to cope, our biology is prepared to do something to protect us. And there are 4 common ways that our biology will really pretty automatically respond to try to protect us. The first way is through fighting, through saying, I want to take this stressor on, right? I'm going to become aggressive. I'm going to cry. I'm going to flail my arms at you, bite, do whatever I can to protect myself from a present threat. Flight is also a form of coping with trauma, especially while it's occurring. We may try to avoid the thing that is causing us stress. We may try to run away. We may turn our face away if we're a very young child and we can't actually walk or ambulate to run away. We may even just withdraw our eye contact or withdraw from touch, or even give caregivers signals that we don't like their touch anymore. Touch maybe used to be soothing to us, but now we cry when we're touched because we don't trust that touch anymore. The freeze reaction is also common and is perhaps most strong in very, very young children who can't run away, who don't have much strength to fight back. The freeze response is one of inaction, shutting down. You can almost think of it as playing dead so that the bad thing will pass you by. And in very young infants, this can look like suddenly falling asleep, staring spells, being very still, being less interactive. And there's also a fawn response that we're starting to learn more about. This can actually look like over-affection. Sometimes when children don't know who to trust, they're just hoping that proximity to anybody can offer them some protection. So we may see over-affection, sometimes to adults we know, but also sometimes to adults that we don't know. We're just willing to give it a try in case they can actually help us. This can look a lot, especially as kids get a little bit older, like people pleasing or even lying, because a child might be saying, I've got to make sure this adult likes me. And so whatever they want to hear, I'm going to tell them that, even if I'm hardly even listening to them, or even if I won't do what I said I was going to do. In this moment, I'm going to be safest if this adult likes me. And so I'm going to tell them anything that they want to hear. These responses are not bad in and of themselves. These responses are really important ways that we protect ourselves. But the issue comes in when our body is taught that we have to use these responses all the time in order to survive. That takes away from opportunities that we have to be in the present moment and to learn, and ultimately can make it hard for us to form relationships, the very thing that we know is so crucial for our healing. And so when these, what I call 4 F's of trauma, are engaged frequently, significantly, over a long period of time, in infants, this can start to manifest or look like poor sleep patterns, difficulties with feeding, crying around feeding times, rejecting feedings, maybe being interested in feeding all the time, persistent or unremittent crying that may even worsen when people try to soothe us, restlessness, gastric disturbance, tension, looks of distress and fear on their faces, even lack of weight gain or failure to thrive. Even if we're fed enough, our bodies might not feel safe enough to really digest and utilize that food. And it can also show up as failure to meet expected milestones, like not social smiling when expected, not saying our first words when expected, or not trying to engage in call and response or interactive play when expected. In young children, say ages 2 to 5, when they engage their 4 F's, or those fight, flight, freeze, fawn responses, quite frequently and to a significant degree, we can start to see difficulties learning, especially around the time when they start to enter preschool, and we're hoping they can start to learn colors and letters. Delayed skill development, behavior challenges that can sometimes look like acting out, but that again can sometimes look like that fawn response or over compliance and not really using our own voice or having a mind of our own. We can see acting out of the trauma in their play or in the ways that they interact with others. Kids who've seen a lot of violence in the home might use violence as a tool when they are with other adults or children their age. This can look like challenges forming relationships, trusting others to kind of enter their sphere. It can also look like physical health problems, stomach aches, headaches, eating and sleeping concerns, and general kind of tension or hypervigilance, always scanning the room for threat instead of paying attention to what we're trying to teach them or what we hope they can learn. This content can be hard to listen to. It's hard to think about the fact that very young children can be so affected by early life trauma. It's hard to hear that we live in a world that cannot completely shield children from experiencing bad and hurtful things. But I want you to know that it is never too late for healing through relationships. Even if the child is older than 5 years of age or older than 3 years of age, by the time we start to intervene, we can always use consistent, predictable, nurturing relationships to heal children. And some tips for starting off this path of healing through relationships. One thing that you have to know is that if you are trying to care for a trauma-exposed child, teach a trauma-exposed child, be a therapist for a trauma-exposed child, the first step in that process is you bringing your best self to the situation. You bringing a calm voice, a calm body posture, a calm and regulated tone of voice and presence to the situation. We also need the ability to be fully present, not distracted by our phones, not distracted all the time by other children who also need us. It's a hard balance, as many of you know. And we also need to be willing to bring play to the healing of children. Children learn best through play. We'll talk about that a lot more in our next video, but bringing a regulated presence and using play to connect with children can really help us on the path toward healing. For now, we have 2 more videos coming in this series, but I think it would be really great if you can find the time to check out some of these at-home resources that expand on some of the concepts that we've talked about today and that can help you feel truly more confident in working with children who have experienced trauma. Again, our vision at the Children's Place is childhood restored, and we hope that some information about how early life experiences can affect children's development will be helpful to you in terms of restoring the childhood of the children that you care for.